Jared, how's the weather in Florida?
It's really hot, but
Yeah,
sounds like from everybody else, I have it pretty good here. So no complaints.
yeah. No, it's it's winter for Jose, right?
Yes, this winter, but it's a nice day today. It's
Oh, that's
sunny
great.
and it's not that cold. Luckily. Zach,
Fantastic.
are you in New York or?
I can't claim New York. I have to say New Jersey now because I'm in Hoboken. But close enough. We're not supposed to go outside today though. Apparently there's smoke, I think. Again, from the wildfire.
Yeah, it's back.
On the wildfires again.
Yeah. Okay. Always something in New York.
Well, I think people are just starting to come in, so we will give a few minutes for everyone to get logged on. But it's good to see the three of you. All right, so let's see. Yep, people are starting to come in. If anyone in the chat wants to give us a shout out where they're located, you've got me in Brooklyn, New York, Jose in Buenos Aires, Argentina, Zach in Hoboken, New Jersey, and Jared, Miami, Florida. Is that right?
Miami Beach, not to rub it in.
Excellent. Oh, we've got a good part of the northern hemisphere covered, don't we?
I think Jared has us beat today though.
Right. And we got Messi, also not to rub it into Jose, but
Oh, there is that.
Yeah. Yes. It's a big reason to go to Miami in the next couple of months.
Great. Well, looking forward to get into this with you guys. It's been pretty exciting to learn about your story and your journey and what you're up to. And, I think a lot of people can empathize with not only your stories, but also what you're trying to do to improve, the lives of others and the stories that they have. And, before Zach and Jared, you guys jumped on, Jose and I were talking about just that power of community, how great it is to have people together, being able to share those things and uplifting each other. So we're just having a little chat about that and look forward to sharing that with our attendees as we get going.
Likewise.
Yeah, so we're also talking about like common values, like between Amalgama and SelfiHealth, and how like the sharing and the possibility of empathizing with other is so important. We see that on the like empathizing with our users and with the business that we're working on, and well, in your case it's so clear now the importance of sitting in the other person's shoes and being able to feel and go through and accompany the other person.
Yeah, I think that's both also when you're a peer, but also when you've been through it before and can kind of share your experiences and give back, right? So at multiple different stages, it's vital.
No doubt. All right, well, I think we've got a good amount of our registered attendees in, so I think we'll get ready to kick this off. Want to thank everyone for joining us today as we talk about our topic: how can technology help with health when healthcare can't? I'm joined today by the co-founders of SelfiHealth, Zach and Jared, who I'll let introduce themselves in a few minutes and tell a little bit about their story, as well as Jose, who's one of the co-founders and the head of strategy at Amalgama. And I'm Travis Pomposello, head of growth at Amalgama, and I'll be moderating this panel today as we get into SelfiHealth, revolutionizing peer support digitally. So I'm going to go ahead and throw it over to you, Zach and Jared, and whoever wants to answer first. Knowing the two of you and hearing your personal journeys and and all that experiences that you guys went through. Tell us a little bit about that and how it influenced the idea and the eventual development of SelfiHealth.
Yeah, happy to. So SelfiHealth is really a culmination of our life experiences. Jared and I have witnessed firsthand both what peer health can do and what it sometimes doesn't do in its current state. And so from personal experience, I was born with a congenital heart defect. I was told when I was 12 years old that I could no longer do things that a lot of us take for granted, run around at recess, do gym class, after school sporting events. And that had a profound impact on my life, obviously, from the mental side of things to the physical side of things. And I eventually did have open heart surgery when I was 20 years old. And obviously that had quite a profound effect on my life. And again, brought back what I had experienced. And after I moved to New York City for law school, where I met Jared, I thought it would be a good idea to run marathons to raise money and show you can do whatever you put your mind to. I wound up getting hurt, and I required some invasive surgeries that have left me in chronic pain. And it wasn't until that point that I really recognized what the power of peer health support could do, but also was lacking, right? And so, when you're diagnosed with a condition, or whether it's cancer, heart disease, or something as what people would call minimal, like hip surgery, people go to Dr. Google and they look for others. But unfortunately, Dr. Google takes you to places like Facebook groups and Reddit boards, which are structured off the premise of let's put a lot of people in a group that all have the same condition in common and they'll hit it off. But in reality, what you find is people don't feel comfortable sharing about their intimate health issues with a group of 500 or 5,000 strangers that they don't really know. And then when people do post, because they're structured as forums, they have no control over who's responding. So you get responses from people that you have nothing in common with but your health concern. And I needed more. I wanted someone that could connect not only about my health concern, but also that wanted to get back to running marathons and was my age and lived in New York City. So I could really have that peer, because we know what the positive health effects are of meaningful peer health support. There wasn't a place to get it.
Right. So that's kind of where Zach looped me in, because we had experienced it already between us, the positive effect that having actual meaningful support compared to these other options could have on a health outcome. So for me, Zach and I met in law school, and during the second month of school, I woke up one morning and I had a TIA mini stroke. I was 23 at the time. I was an athlete in college, still working out a lot, training. And then all of a sudden, one morning, just all of that was kind of taken away from me. Spent a couple of days in the hospital, months in and out of tests. And just as you can imagine, first year of law school, having your identity ripped out of your hands, and for something especially where it wasn't like a broken leg where I could see it, it was just something going on inside me. It was causing a lot of problems for me, both mentally, emotionally, and physically. And Zach came to me and told me I'd been through the same thing. I was told a few years ago, you're never playing sports again. And we literally met like 3 weeks before that playing basketball. And just hearing that and having somebody to talk through what I was going through at the same time just made a world of difference for me. And so Zach came to me 7 years later when he was having issues with his hip. He thought I could be a person that could relate to him as an athlete. But the truth was, although I could relate on some level, I didn't have any experience with a chronic hip condition. And around the same time, I went in for simple surgery, had some complications. I was in the ICU for 3 days, and I'm lying there thinking the same thing. There's nobody there I could talk to. The nurses, the doctors, they can't relate. I'm just lying here. Why am I not using this phone that I could be, obviously at the time, it's the last thing on my mind, but I could be on the phone downloading various amounts of dating apps that exist. There's 100 filters I could use to find the person who's most compatible with me for that. But right now, I need peer health support. Why isn't there something where I could go on my phone right now when I'm lying here when I need it the most and find that person I could talk to who's either going through it or has been through it and get that peer support I needed at that time?
Amazing. And I think we can all empathize with your stories, whether it be personal or someone we know, someone really care about, and those feelings around that. And thank you both for sharing that, and applaud you both for bravery of sharing those stories, but also putting yourselves out there to build a product like this. It's tough to be an entrepreneur. Being an entrepreneur myself, and Jose and I working with entrepreneurs every day at Amalgama, we hear a lot of these incredible stories that have pushed an entrepreneur into wanting to build a digital product. To that, Jose, I'd love for you to introduce yourself and maybe speak a little bit about your experience working with entrepreneurs like Zach and Jared.
Yeah, thanks a lot, Travis. And thanks, Zach and Jared, for sharing your experience. I'm one of the founders of Amalgama. We began the company 10 years ago. As a background, I'm an engineer, and I have a lot of focus on processes and making sure that things go through a given process and are working as planned. And in Amalgama, we found out the importance of understanding our users and getting like the right product. And we've been working together hand in hand with startups and with entrepreneurs for the past 8-10 years. And we've seen lots of different products, but the main different projects, but the core of each of them is to make sure that we are addressing a real need of our users. And I think that that's the key factor to take into account when developing a startup, and well, that's what we try to do in Amalgama. And that's how we also got to know Zach and Jared.
Yeah, it's always, I'll add to that, for Jose and I and the rest of the team, when entrepreneurs who have a product that are deeply rooted in values similar to ours, it just makes it all the more enjoyable. So anyway, I'm going to jump back into SelfiHealth and the product that you guys have. And I know there's a lot of different discussion boards and support platforms out there. Jared, what would you say are the most unique aspects that SelfiHealth brings to the market compared to those?
Yeah, so I think the main difference is, like, based on our experiences that we just spoke about, we recognize that instead of having say 1,000 people to have superficial conversations with when you're posting, sharing your story, really exposing yourself, putting yourself out there, and people you don't know are responding to you, or they're responding to you with things that are just irrelevant. I think it just really discourages anybody from participating in their healthcare. And what we found was, when you have somebody you could trust, somebody you could talk to intimately, somebody who really understands you, making it meaningful, you're way more likely to share. You're way more likely to hold each other accountable, way more likely to comply with any doctor instructions you might have, and just overall look out more for your health.
Yeah, I'm still sort of chuckling inside, Zach, with your Dr. Google. I can't decide if it's a good name for a band, or maybe a doctor should really just open a webpage called Dr. Google and acquire a lot of clients. But Jared, you and I have spoken about this offline together Zach, you and I have spoken about this a couple of times, offline together, about a lot of the challenges you faced during the development of your first version of SelfiHealth. And I know you've employed a lot of strategies to overcome those challenges. If you would please share that with the entrepreneurs, who are attending today, that they could consider, and some best practices you could potentially share.
Yeah. I think there's kind of two fields here of entrepreneurs, right? There's those that start with nothing or quasi nothing, and those that are fortunate enough to come from backgrounds where they can self-sustain or have the network already developed of people that are willing to give them money to go out and build something, right? And so from us, as two former attorneys, we didn't have that. We didn't have the background in entrepreneurship or technology, development, engineering. And so we didn't have people just at our beck and call waiting to give us money just for our idea, right? And so when we had this idea, the feedback we were getting was, love the idea, but come back to me when you either have a product or revenue. And so we kind of took a step back and said, interesting, don't really see the path forward for revenue without a product. So that means we have to build the product. And so we said, how do we do that? And having no clue, obviously spoke to a lot of people, friends, family that we thought had tangentially done something related. And what we came across was this idea of kind of, how do we do it for the cheapest way possible just to get it to market, right? And that was the reality of the situation we were faced with. Is we have this idea we think can work. We have this hypothesis. We need to prove it. And we need to prove it without being forced to move from my house and sell all my goods and be able to eat dinner, right? And so what we did is we found all the horror stories that everyone talks about, hiring developers based in certain countries. But we ripped the Band-Aid off and we did it anyway. And so we outsourced our development to one of those countries. And it was quite painful. Obviously there are promises that are made that sometimes don't get fulfilled. There are communication barriers just in terms of language, time differentials, right? So for Jared and I, we spent 1.5 years building this app. It should have taken 8 months. We had various pain points. You ask my wife and she'll tell you that we literally got a second bedroom in our apartment because I was screaming at these developers too much and it was too loud at 5 o'clock in the morning. So I think the reality is you have to kind of take a step back and say it's great to kind of spend as little money as possible, but there's also the idea of like move fast and break things, right? And so what we've tried to learn from that experience is like, as soon as we could take it out of those hands, because we reached a plateau with our overseas developers where it just was clear that we couldn't continue, right? And so as soon as we could, we took that code and we brought someone on board as more of a part-time. And really what we decided to do from that point forward is like move fast and break things, right? So control what you can, but I think that really strikes a chord with the narrative of like, do your due diligence up front, like make sure that expectations are clearly set. And I'm not just talking about, here's a proposal for an app, here's a contract, this is what we're going to build, this is the timeline. No, I'm talking about like in the weeds. How are we going to communicate with each other? What means are we using to do it? How often is it going to occur? How are changes made? Because if you don't, you're going to get lost throughout that process.
Yeah, that makes a ton of sense. And Jose, I'm going to throw this to you because I want to have this sort of elephant in the room, right? Obviously, I'm in New York City, head of growth for Amalgama. Amalgama is a nearshore company in Buenos Aires. Zach was speaking a lot about overseas entity. I know, obviously I'm part of the company. I know we work very hard to mitigate some of those problems that Zach and Jared just shared with us. Jose, 10 years doing it. Anything you want to add to that and speak about how, you've overcome that working with US clients and maybe any other key advice, based on what you heard Zach just share.
Yes, 100%. Like I totally empathize with what Zach was saying. I think that there are 3 key aspects that we worked through in order to make sure that those pain points are not happening in the projects that we're working on. The first one has to do with culture. I think that we're culturally very much related with the United States, and especially with the New York area. And I think that bridges the gap a lot. The second one has to do with time zone. We are awake and sleeping at the same time our clients are, and that it's helps us like communicate a lot. And that is the third one, like be able to make sure that we have like the right communication channels and that we adapt to the way our projects and our partners want to communicate. Some of them prefer to use WhatsApp. Some of them prefer to use email. Some of them prefer to use Mattermost or Slack. The flexibility of adapting to the communication channels and make sure that we are available and answering fast is really important. For us, the fact that we answer, that we're responsive really, really fast is very important, because we try to, again, empathize with the persons, the people that are developing with us, and they are maybe 8,000 kilometers away, 10,000 kilometers away, and must be a little bit frightened and want to know what's going on, and being able to communicate that is really important.
Fantastic. I totally echo and are aligned with what you were saying, and experienced that myself as a client, formerly as a client before I joined the team. I want to get back to the product, and there's two things in particular I want to talk about that kind of really stick out to me, or I think worth talking about around SelfiHealth, and where we talked about how it's different than the generic message boards and Facebook groups and things like that. And this is a kind of a topic that's on everybody's lips these days, is around algorithms and machine learning and AI, if you will. And SelfiHealth, from my experience, has a strong matching algorithm, and love to get into some of its functions and the factors you both took into how it considers to make those matches, but matching individuals. You spoke about how you matched to each other, and I imagine that was taken into consideration in building of that algorithm.
Yeah, definitely. So even though Zach and I didn't have the same exact condition, I was still able to receive that peer support I felt I needed at the time, which made us realize it's not all about condition. You could be like these existing groups, and everybody who had a heart attack, throw them in, see what sticks. But it's really inefficient. You might get lucky, but it's super inefficient, and it doesn't really make sense. To us, what makes sense is finding out what makes the person who they are and using that to build out those matches. So Zach and I had basketball, love for sports in common. We had the fact that we were both told we couldn't play sports. He overcame it. I was looking to overcome it. We were the same age. We were both soon to be lawyers, living in New York, and all those things kind of made it work. And they all are a piece of that puzzle. It's hard to say who's going to be 100% match, but when you combine all those possible factors, you could use that. You could use the math, the statistics behind that to figure out what's most likely to be. It's still, getting 100% of the time, probably unlikely, but we want to at least put the odds in the favor. In the future, in terms of using AI, having things machine learning that could help us improve the algorithm, and also get conversations going, figure out what resources people should be seeing that could be helpful to them, figuring out based on symptoms, and then other people who had those symptoms and then eventually had good health outcomes. What did they do to get to that point? What resources did they use? What medications were they taking? What exercise were they doing? Really trying to get those data points and continue to improve not just how our app functions, but how the healthcare system could function as a whole.
Yeah, Zach, I want to ask you sort of a part B to that, and it's, I think, especially pertinent to a product like yours that is around healthcare. Is you're gonna have a really, aside from a diverse user base of, let's call it, ailments or health conditions that people are suffering with, I can imagine a very diverse age range. And I work in tech, but I look at my tech user prowess versus my 19-year-old son's, very different. How have versus, like, maybe my mom, or someone else in my family, how have you taken that into account with dealing with those varying levels of tech proficiency among all these different age groups and user groups, and I imagine potentially disabilities as well?
Totally. Yeah, I think what's important to remember here is, like, we're not creating peer health support, right? Like, peer health support, the concept of it has been around in various forms since healthcare has been around, whether it's one-on-one peer health support or more recently online peer health support. What we did was kind of take the approach of those Facebook groups, those Reddit boards, those online communities work for a certain demographic of people, right? People that are prone to using them, people that like kind of just saying everything and seeing who responds. But what we also found in talking with our customers is that a large majority of people that join their support networks aren't really participating. They've joined, but they're silent members. They don't feel comfortable sharing about the realities of their health concerns in a group setting. And so what we did was we kind of said, how do we modernize peer health support? It's one of these things where you talk about healthcare, you say it's a very antiquated industry, right? Like, change is hard in healthcare. It is. It's really hard. It takes forever, but especially with respect to peer health support. And so what we did was we said, all right, let's make peer health support fun and engaging. it's not a fun topic, right? It's not something that people enjoy having to do when you're faced with a chronic health concern. So how do we make it the best experience possible so that they want to come back because they see it as a place that actually helps them, both physically and emotionally? So yes, it's about providing it on a mobile app that speaks to a younger demographic, right? But it's also about what they're doing on the mobile app. So some of the things that we like to do are making sure that, for example, our groups, the groups are not created by anyone. You can't log on tomorrow and create a group on our app. We only work with trusted nonprofit organizations so that when people know they're joining a group, the resources are coming from validated sources that they can trust. Within those groups, what content are we providing people? So right now, the content we provide on our app are things like survivor stories, YouTube videos, but then just as importantly, organizations host live events. But in the past, if you were to ask people about peer health support and what live events they are, I bet you a lot of people would say it's a group of 10 people sitting around in chairs talking to each other about their health concerns. That is not what we're doing. What we're doing is having things like nutritionists come on and do heart healthy cooking demos, low impact workout classes, podcasts, influencers, to really make it appeal to people that see it maybe as a start, a place where they can get one-on-one peer health support, but also that place that when you have a health concern, if I were to ask you today, hey, you want to go on a date, what app do you think of? You can name Tinder, Hinge, Bumble. But if I'm going to ask you, hey, you have a health concern, what app do you go to? What do you say? So we want to make it a place where people say, I go to SelfiHealth because I'm getting peer health support, but I also have these resources from trusted organizations. And those things combined allow me to really take control of my health from diagnosis to discharge to hopefully better outcomes.
It's great. I listen to you speak about this, and it's sort of truth and jest here. I feel like, you should consider having a group for entrepreneurs, like all of us. You could probably use some peer support, which often kind of verges on the level of needing health support for many entrepreneurs. And on that topic, you guys have been at it for a couple of years. Jared, how do you know you've been going in the right direction? What tools have you used? Any metrics or any data that you use to drive decisions that you could share with people on this call today?
Yeah, so most of it's based on feedback. Always with any business, there's going to be tons of pivots, and you're going to realize you try something and maybe it wasn't the right time or the right thing to do, but you always just keep learning from it and keep persisting, keep pushing on. I think something recently that gave us a lot of validation was part of what we're trying to do is prove that this peer health support we know it does, we know from our experience, but we also wanted to be able to prove that it would lead to better physical health outcomes. And then about a month ago, the US Surgeon General came out with a study basically validating our theory. For example, people with congestive heart failure were 55% more likely to be readmitted to a hospital if they identified as lonely. They had peer health support, then they'd be less likely to go back. And that was across the board, many different conditions, many different outcomes. Talking to hospitals is another way we know we're going in the right path. They all recognize they have a major problem with these readmissions. They have a major problem with patient experience and satisfaction and feedback. And peer health support is a very, I don't want to say easy, but it's a very obvious thing that could be done and easy to implement that would change that for them. It would change the way people view them. It would change their bottom lines. It would change their reputation. So I think hearing things like that from those different players, whether it's on the research data side, our customers, but the people who rely on having their customers happy and satisfied and doing well, hearing that from them really kind of gives us the motivation to keep pushing the direction we're going.
Zach, I feel like you have something you want to add to that. You want to go ahead and jump in?
I was just going to say, I think something that's really unique as well is kind of testimonials from people on the app, right? And so even just yesterday, we met with someone who sent us an email saying, this is exactly what I needed. And we spoke to him. He had a heart attack when he was 33 years old and had another heart attack when he was 40 years old. He was extremely fit. He is a high school soccer coach, works out all the time, ate healthy. And he said to us, I would go to all these Facebook groups, I would go to all these Reddit boards, and I just didn't get it. I was talking to people. I wanted to connect with another 40-year-old that wanted to get back to lifting weights and eating healthy. I didn't want a sob story. He said to us, I was almost suicidal, right? And when you hear something like that, and I think we talk about health in these big picture, like how do we change healthcare? But like, these are people. These are people who are at their worst, their lowest points, right? Like something like dating. We have an app for people to go to. Something as valuable as healthcare. If you don't have your healthcare, there's no dating. There's nothing. So hearing something like that is something that really validates what we're doing.
Yeah, it's very powerful, incredible, and very true. You know, Jose, you've worked with a lot of startups. You've seen a lot evolve. Unfortunately, seen a fair amount fail, and also a lot of experience working with first-time founders. You know, coming out of other careers like Zach and Jared. I mean, anything to add to that? Any other best practices? You know, setting maybe key results or metrics, or any other principles, you know, that these guys could take into account, potentially apply, or maybe other entrepreneurs who are on this call.
Yes, I think I agree 100% on what they say about the testimonials and about the people. And at the end, we're building this platform for people and for the users. So making sure that users are adding value on our platform is key. That's why for me, like a metrics that I like very much watching too is retention, is seeing if our users that registered are keep on using our app in time. And following that pattern and making sure that there's a portion of all of the people that register to our app that are continuously using our app and keep on using it in time, give us a sense that we're going on the right direction because we're adding value to them. It might be tricky because at the beginning, people would go, or someone would expect that 100% of the people that register to the app will keep on using it in time, and that would imply like 100% retention rate, and usually good retention rates are between 10 and 20% or even 30%, but it's not everybody that will try the app will be a regular user in time. But if there's a portion of them, 10, 20, 30% of them, that we are adding value to them in time and they keep on using the app in time, we're doing a good job. And we'll have to understand who they are and what is the value they are adding, and to target better our growth and marketing campaigns and making sure that we are reaching those target users. But I think that would be a metrics I would pay a lot of attention to. I usually try to.
Yeah, that's great advice. You know, as we close out this topic, I'll do a quick lightning round and throw a quick question at each of you. Zach, something you would have done different?
I honestly think it starts from the beginning, setting expectations appropriately. This has been an endeavor that we have taken on now 3 years in the making. Obviously, anyone will tell you we'd like to be further along than we are today. But I think in the last 6 months, we've really ramped up to the point where we're like going at full speed. I think setting expectations both for ourselves and for the people we work with. This is what we want out of this. This is what we're expecting out of this, so that we can hold each other accountable.
Awesome. Jared, something that you two have done that you would not change, regardless of how much pain it cost.
Not change. Yeah, I mean, just that kind of that slug work you have to do, just the really, really boring stuff where you are creating CRMs to do your outreach and just sending email after email 1,000 times over. Not the most fun experience, but gratifying, especially when it pays off.
Yeah, no question. Jose, I'm going to make it the hardest on you. What would be your three things that entrepreneurs building a product should not skip?
I think that the first one and the most important one would be to test and to validate. I think that as Zach said, we had hypotheses that we thought might be useful. So transforming those hypotheses to real insights and to get to know our real users is, I think, is key. So the first one is to test, and the second one would be to test fast. It's like don't spend like a lot of money and a lot of time building something huge just to get to know that users are not looking for that. So and the third one is have the flexibility to pivot, to listen to users and see, like, maybe you had an idea, you thought that you had the solution, but they're telling you that the solution is not in that way, that you got to pivot, you got to go in another way. So like, have that flexibility, be humble enough to listen to them, and because at the end of the day, we're building these things for them, we're building it for the user. So listen to them and have the flexibility to pivot. So I'd say validate fast, test fast, and be flexible to pivot.
That's great advice, and I completely agree with that, and wish I listened to that when you told me that when I was a client. But it's a pleasure to get to tell it to our clients now. I want to pivot to the other side of being an entrepreneur, which I know is something both you, Jared, and Zach are going through deeply right now, is fundraising. Yep. So I know you have some ongoing fundraising efforts. All entrepreneurs have to tackle this. Very few of us have the luxury of being self-funded founders and co-founders. Perhaps maybe the second or third time around after we all hit our goal of exiting big. But it's a challenging moment economically, for sure. Every day we're hearing it on the news here, and we know that investors are very picky these days. So I'll leave it open to the both of you. How are you addressing those, the concerns of the economic concerns that investors are struggling with, as well as I'm sure all the difference of opinions that you get from your targets.
Yeah. Well, I'll start off by saying it's a learning experience, right? And what I like to tell people when they ask me about fundraising is I say, it's the worst form of dating you could ever imagine. Because what happens is you get a lot of no's. Sure, that's fine. You get a few, let's go to second, third. But what happens the most is you get ghosted. And no one likes getting ghosted, right? You either want that quick no, or you want to move forward. The ghosting is what kills you. So a couple of things I'll say, and Jared can piggyback on this because he tells me all the time. One is you can't get down on yourself. You're going to get 1,000 no's. And I've heard this story from other entrepreneurs that we talked to. We were at our last, 5 days fundraising, and finally the last person said yes, right? Like, you have to have that mentality of it takes one, and that one will parlay into the others and the others. But I think also it's about discipline. So, when we first went out to fundraise, we got a lot of questions. We didn't have all the answers, right? Because everyone has different questions. Everyone has different opinions. And so, yeah, you listen, but you own your skill. You get to know what they're really looking for. And you know what? The reality is a lot of it is not what you say, it's how you say it, right? And so you have to be open and honest. This is where we are today, but this is the direction we're going. And also pat yourself on the back a little. I think as entrepreneurs, we tend to be very hard on ourselves, right? Like, we have this grand vision, but we're not there yet. So we're constantly frustrated because we're not there yet. But we don't really take a step back and look at what we have accomplished. And I think when speaking to an investor, that's a really good opportunity to pat yourself on the back and show them what you have accomplished, especially because we've done it with zero funding. So we've bootstrapped completely to date to work with one of the largest nonprofit organizations in the world, to have letters of intent from major hospitals, to have actual users on our app. which is something that I don't think Jared and I do enough of, quite honestly.
Yeah. And then, right, imagining doing what we did bootstrapping and having the mindset, imagine what we could do with more support. And I think, yeah, just adding to what Zach said, just being able to be dynamic is the main thing. I guess like kind of a funny thing in retrospect for us, we were all hyped up, ready to just get going with our initial fundraising efforts. And that was the week the SVB bank collapsed, right? And we had to be sensitive to that. We had to push things back a week and make sure people felt okay before going back out to them. I think my experience as a former athlete, I was in a sport in bobsledding where you have like a week to get ready for a race, and there's different things you could try going down the track, and you just can't get stuck trying the same thing over and over just because somebody told you that's how you do it. Because then it'll come race day and you'll just have the same result. You'll crash again or whatever happens. And you need to just be able to be willing to try new things, even if they make you uncomfortable. Take some chances, close your eyes, hope for the best. And I think, yeah, doing that, just staying dynamic, changing it up, but still doing it all with the same discipline and focus and kind of day-to-day game plan is what could put you over the edge.
Yeah. You know, I think about it, you know, spending a lot of time looking at our clients, investors' materials and pitch decks and, you know, helping and coaching them on that. I have to think you both field a lot of questions around the healthcare industry in general, right? Certainly known for bureaucracy, red tape, long sales cycles, you name it. You know, I'm sure you've got a great list of answers for those questions, and for those other entrepreneurs who are, you know, entrepreneurs in the health and wellness space. What could you share as you know, some of those strategies you have with combating that?
Yeah, I like to just be honest, right? Like everything that these people are saying comes from a place of hopefully experience and not just anecdotes that they've heard along the way. Some of it is anecdotes. So I think it's being honest and calling their bluff, quite honestly. I think sometimes as founders, you sit in this chair and you want money from investors. So you kind of hold them to a higher standard and say, you're above us, but that's not true. I think it's kind of flipping that narrative to say, we have something of value to offer you. And the other component to that is, so what, right? Like, yeah, there are long sales cycles in healthcare, but it's been done before many times over. And I always like, sounds corny, but take Facebook, take Microsoft, take Amazon. They all started somewhere, right? They all started from nothing and went on to build massive companies, not one day in. It took them years. And yeah, that sales cycle is long in healthcare. But I think one of the really fascinating things about our clients, hospitals who we sell to, they're owned by large conglomerates for the most part. So when you can break through that wall and tackle one hospital, it opens up the door to a much larger potential. Whereas a lot of other sales cycles might be shorter in nature, but there's many more clients that you have to sell over and over and over again, which means you have to hire more people to do that, right? And so kind of like flipping the script a little bit and talking about the positives of that long sales cycle instead of just all of the negatives that everyone wants to perceive.
Yeah. Jose, over to you. I mean, obviously the sales cycle, the fundraising cycle that entrepreneurs go through and struggle with have a deep impact on app development, their business models. You know, any learnings or any advice that you could share?
Yes, I think that and it comes to the same. No, when we have a solid user base and when we have revenue, I think that we are standing on a much solid ground in order to look for investment. And if we can reach like a break-even point where we can, with a little revenue, just and have like a very light structure of team, if we can cover that with the revenue we are generating, we are in a very strong position to negotiate with investors because we can wait, because we have runway. And I think that is a very good strategy. Of course, it depends a lot on the industry, it depends a lot on the project and on the situations, but being able to generate revenue early on, I think it's a very good strategy to negotiate and to get like a very good position towards fundraising.
Great. Well, we're at the 45-minute mark and got a couple of great questions, but I want to close out this section on fundraising by asking both you, Zach and Jared, what are your current fundraising goals, and hitting those numbers and raising those funds, what does that mean for the future plans of SelfiHealth?
Yeah. So right now,
If you had $1 million, what would you do with it? Question.
yeah, okay, that's the number I was gonna say. Right, we're raising $1 million to be able to accomplish our goals, not just to get started, but to have runway to scale from there because of the nature of who our customers are. With hospitals, for example, they want to try it first in one. If it works, they're usually part of larger systems where they could expand from there. So the first thing we would do is get the app up to speed to where we need it to be to do those integrations with EHRs to get our HIPAA SOC 2 compliance up and running. And then obviously it's always, and this has been, one of the frustrating things is that you always, when you're growing, when you're bootstrapping, you always have all these ideas of what you want the app to just look like and how you want it to work. So making some upgrades there as well. So those would be the first things we would do. And then quickly have some success, prove concept, and scale from there.
Yeah.
So anything you want to add on that?
No, I think to your point earlier, you said, how do you prove that this is something people want? Like, what are you seeing? Well, we do have letters of intent from hospitals that are ready to test this product out so that we can integrate into electronic health records, so that when a patient is getting diagnosed or discharged, with a click of a button, they've got our app sitting in front of them and they can go through their care journeys together. Unfortunately, that costs money. So it's the classic chicken or the egg, right? Like, we have customers waiting, but in order to have those customers come on board, we need money to implement these changes and improve the app functionality, et cetera. And so I think that's where we are with investors today. Is we've seen a lot of traction. We have 4 nonprofit partners that we're adding this month. We have actual users. We have hospitals that want it. And now to I think Jose's point, like, proving that hypothesis as quickly as possible is of critical importance. So like, that $1 million is not what we need to get in the first hospital. That $1 million allows us to grow over the next 18 months.
Perfect. Well, let's get to these questions. We have a few minutes, about 10 minutes left. So I'd love to address these questions that we have from our viewers. The first question is from Dora, and Dora asks, what has been the main challenge to expand and grow?
Yeah. Healthcare. Everyone talks about it. Healthcare is a notoriously antiquated industry, and what we're doing is new, right? And so not only are you saying, here's a solution for something that already exists, right? And we're just doing the same thing other people are doing. We're not creating the same peer health network that already exists. So not only are we going into an industry that's been resistant to change, but we're talking to people about something that is new in an industry that's been resistant to change. So we have to combat that by, like Jared mentioned, showing actual demonstrated facts that work in our favor to demonstrate what the value add is and minimize things like risk, how much work it's going to take these hospitals to implement, and making sure that we decrease any potential ability for them to say no, really.
Jared, anything you want to add on to that?
I mean, in one word, inertia, I guess would be it. So yeah, like Zach just talked about, just going into an industry where they're resistant to change. They have problems like staffing shortages, and even just being able to get that message across that this is actually something that will help make things more efficient, as opposed to something that would add to your plate.
Great. Fantastic. Dora, I hope that answers your question. Move on to a question from Steve. And Steve asks, do you think it would be useful for your users with medical conditions to have a tool that helps them understand how their mindset, emotions, and behaviors affect their well-being?
Of course. There have been a lot of investments over recent years made in mental health technologies, right? To improve mental health technologies. But there hasn't been as much as, what does Pure Health do for physical health? The reality, if you speak to anyone that's affected by a physical health concern, whether it's something like cancer, heart disease, or just a hip issue, you don't have a physical health concern. You have both a physical health concern and a mental health concern. They go hand in hand. Without tackling one, you don't tackle the other. So we're actually working with a nonprofit that's in the mental health space. And the idea there is to help people that are affected by heart disease, stroke, when they come onto our platform, not just get physical help, but also get that mental help that they need to support them on their journeys, so that we can really take a full 360 look at this person.
Yeah. And I think it's the most important thing. You just got to, going back to my story, 3 days in the ICU, and I talked to a physical therapist. I was texting her because, again, I didn't have anybody to talk to. So just texting her. And she's just reminding me, like, you have to visualize yourself getting out of the bed, going home in 3 days. And I think it really just starts with the mindset. If you're negative mindset, whatever the injury is, it could be a strained calf or recovering from a serious stroke. If you don't have that mindset down, you're probably just, it's going to be really hard to get better from there. So I think it's actually just, everything starts with that.
Yeah. Steve just chimed in with a follow-up question, which I think is really relevant. Would love to ask you both. And he asks, there's evidence that shared decision-making between doctors and patients improve outcomes. I wonder if your tool would help patients to know how to evaluate treatment plans their providers are recommending, so that they can share more effectively.
Yeah. I mean, at the end of the day, think about what we're doing. We're creating a platform where people are sharing about their health concerns. You know, one of the things we did with our app was include something called a health timeline, which allows people to kind of track their own health, right? They can say, I went to a doctor today. This is what he told me. Or my goal is to run a marathon, and today I ran 2 miles, kind of updated over time. So you just have a record for yourself. But what are we doing? We're collecting data, right? And that data is really, really valuable. I mean, I always love to use myself as an example. When I had open heart surgery, they said I would need my valve replaced every 5 to 10 years. It's been 13 years, knock on wood. And my cardiologist says my valve looks brand new, but we don't know why, right? And so what we're really hoping to do at the end of the day is take people that all have common characteristics, use the valve example, had the same valve put in at the same point in time in their lives, and have the same other characteristics in common, and try to extrapolate something from that, so that we can then go work with physicians and research organizations to say, hey, this is what we found. Direct your research here. This is the treatment plan that works for these types of people. This is the treatment plan that works for these types of people. And that's where I think really things get really interesting with what we're doing, because you think of this as just like a peer support tool. But what are the outcomes that come from people communicating regarding their peer health?
Yeah.
Getting better approaches. And if 10 people are giving you advice and one is exactly like you in all other regards, probably does make a lot of sense that they would be the one who could probably offer the best advice.
Fantastic. One last question. Joe, I'm going to put it to you, and maybe Zach and Jared will have an opinion also. This comes from Sarah. As more and more entrepreneurs are entering the digital space, especially in healthcare, differentiation becomes critical. What current trends or innovative approaches in app development and products do you think could help startups stand out in a crowded market?
That's a good question. Travis, I think that a big trend nowadays with the health apps are wearables. and having more input of how your body is functioning while you're performing exercise or while you're sleeping and that. So having more information in that aspect is, I think it's a big trend, and it's something that it's something that came here to stay. I think that it's we see more and more applications that are using wearables, and I think that it will be it's a thing nowadays, but it will get bigger the years to come.
Yeah. Zach, Jared, I'm sure you're studying the competition. Any trends you're seeing?
I think it's really interesting because you look at like what we're doing and you could say, oh, we're being trendy in that we're taking the dating app approach to healthcare. But in reality, what I tell you is we are not about trends, right? We are not like, we're taking something that's been around for a very, very, very long time. What we're saying is wearables are great. They help people. Heart rate monitors, all that stuff is great. Telehealth, great. But our most powerful resource is human connection. How do we leverage human connection and technology to allow people to communicate in a more meaningful way? So I would say we're one of the least trendy health tech companies out there.
Yeah,
Jared?
yeah, exactly. It might not be the coolest thing when you just say what it is, peer health support compared to wearable or any cool devices, but yeah, I think everything in my mind, the peer health support is kind of the foundation, and then yeah, a million great things that supplement it, but all of it kind of it plays in the peer health support. What are you doing? Are you using these wearables? Are you using these other tools? And just continuing to have those conversations could help get those best outcomes.
Great. Well, as we conclude, a little, ask give. Zach, Jared, our audience can find you both on LinkedIn. Anyone in this audience, fellow entrepreneurs, if you have any referrals for potential investors for SelfiHealth, I'm sure the guys would love to hear from you. And I know them both, and they're both great entrepreneurs, been at it a while, been in the space a while. I'm sure they'd be more than happy to give you some advice or share some learnings with you if you reach out. On that same end, if anyone on this call or anyone would like to reach out to myself or Jose, talk about app development or any of these things we spoke about today, I'd be happy to have that consult with you free of charge, of course. And yeah, I think that's about it. Any closing remarks, guys, before we say goodbye to our friends who visited?
I really appreciate it. I will say that the unique thing about you guys is, and I probably should have said this before, you're a team. You're not just building an app for someone. So to Jose's point about market validation, you guys are really critical in seeing the vision, understanding how you get there, and making sure that you see that process through and not just building an app and saying, here you go.
Oh, yeah. Thank you for that. Appreciate that.
Yeah, that could have been mentioned in one of the first or second answers, but right, just having working with people that don't just, we're not experts in building apps. So although we want to be listened to, it could also be a little frustrating when we're just throwing things out there almost as ideas, like you're the experts, take it. And then this happened with the people we worked with before with our MVP, and then them just like taking it super literally and not adding any of their own twist or ideas to it. So yeah, it's great what you guys do, and thanks for having us today as well.
Thank you.
Thanks
Jose?
a lot. No, thanks a lot. I totally agree with what you were saying. I think that it's key that the developers or the team that it's taking, it's building the product can apply a critical thinking to what we're doing, and making sure that we're challenging the project from a business and from a user standpoint, because what we don't challenge, the market will. So it's good to make sure that we're being really challenging on that end. So
yeah, I totally agree. And I'll close it out with, echoing what you said, Zach, about team. And that's really our approach is, yes, vendor client relationships, but at the end of the day, the entrepreneur success, your success is our success. And that takes a team effort. So anyway, we're at the end of this. So thank you everyone for joining. Thank you, the three of you, for being guests on this, and best of luck with this summer of fundraising. Super excited to hear how it goes.
Thank you. We appreciate it.
Travis, thanks
Thank
a
you.
lot.
Take care.
Okay.